guys, it's Dr. Denney over at Four Paws at Fulshear Veterinary Clinic, and Maddie and I are going to be chatting a little bit about dogs and cancer and kind of some symptoms that you can look for, how we can make a diagnosis, and different types of cancers that dogs get.
Dr. Denney, is cancer in dogs common?
So I would say that cancer in any older mammal is going to be common. We as just general animals in general, we are part of the animal kingdom, but we have genes and genetics that help us help our body realize when a cell is dividing inappropriately, or and that's what cancer is. It's cells dividing over and over and over and over again with no control. Cells are only supposed to divide a certain amount of times before they stop and they die off and are replaced with new cells. So cancer is when we have cells that are not doing that. We all, as animals, have cells in our body that are there to monitor, and they're there to program these cells to die. And that's why we don't see a lot of young dogs or young animals with cancer. It's not to say that it can't happen, just like humans, like young humans, like kids. But it is much more common in middle to older age dogs. So that's going to be about, as far as when you say something is common, yes, it's common, but we also see dogs of all ages, and we definitely have a population of senior dogs that we see. And of those senior dogs, it is more common to see cancer than not.
What are the common types of cancer in dogs?
So I would say the most common types of cancers that I've seen is we see a lot of different types of skin cancers, like squamous cell carcinoma. We can see some benign neoplasias. So cancer and neoplasia are like the same thing, but you can have benign growths. So we see a lot of lipomas. Those are your benign fatty tumors. We can see melanomas, especially in our black dogs, and their black nails. They're a little more prone to it. We can see squamous cell carcinoma in our kitty cats. We see hemangiosarcoma, which is something that can happen in the spleens of dogs. So in patients that are 5 years old or older, especially our larger breed dogs, you'll be talked to about with our veterinary technicians at their annual exams when we're recommending the lab work that you can get a senior sneak peek, which is where we put the ultrasound probe on their belly and we're looking at the 5 major organs. And we're not radiologists, we might not see something subtle, but if there is a tumor in there, it's like early cancer detection. There's something that we can do about it, especially our splenic masses or our spleen tumors. We don't need a spleen to survive, neither do dogs or cats, so we're able to actually remove that, and that buys time for the pet, and we're also able to send that off to the lab and figure out what type of cancer it is. Those are probably the most common. Sarcomas, those arise from muscle cells, but we can get tumors from the skin, of the tissues underneath the skin, of any organ, lung cancer, bladder cancer, liver cancer, gallbladder cancer, any organ that you have on your, that makes up your body has a possibility to develop cancer. So that's everything: eyes, mouth, bones, you name it, it can develop cancer.
What are some signs and symptoms of dog cancer?
So I feel like this is going to be really vague, because dogs and cats are really good at hiding their illnesses. They're very good at compensating for their diseases until they can't compensate. So we're left with these very subtle changes that we can pick up on. And this is something that you as an owner will notice. And when you bring it to my attention, then we dig into it. But maybe a little bit off on appetite, sleeping more. So we have to remember that age is not a disease. I have older pets that we see that have plenty of energy. So if you have an older pet that all they're doing is sleeping, something's wrong, something hurts, and you need to get them seen. So sleeping more, not eating, maybe drinking more, lethargy. In really serious cases, you can see vomiting, collapse, and even unfortunately sudden death. So there are a lot of these symptoms, which is why preventative medicine it's why we talk about it so much. It's why you'll hear about it at every annual appointment, how important that lab work is, and every older patient we talk about that senior sneak peek. We are trying to catch these cancers when they might be treatable, so we can help your pet to live longer and have a better quality of life.
How will a veterinarian diagnose cancer in a dog?
So it's a great question, Maddie. And I think a lot of clients ask that question, like, well, how do we even find out if we have cancer? So there's a couple different methods. With lab work, sometimes we can get an inkling with elevated calcium values. That can be a sign that there's cancer lurking somewhere, particularly in the anal glands. We can see cancer cells in a urinalysis, so we can get a diagnosis off of an ultrasound, off of x-rays, off of a biopsy. We can even get a diagnosis on like skin tumors that we've put a little needle in and done a fine needle aspirate, which is like a fine needle biopsy, and we look at the cells right here in clinic. And I can usually tell, okay, do I think that this is more malignant or more benign? And usually with my cells that I'm seeing really don't look great and they look scary, I usually send off to a pathologist to confirm and help us make a diagnosis. So we rely on, physical exam and diagnostic testing and diagnostic imaging to get a diagnosis of what we're dealing with, which not only helps, give us, like, we all know what's going on, but it also helps me tell you, well, what's the prognosis, what are possible treatments, what's the mean survival time that we're looking at here, because that makes a difference. If we have a 2-year-old dog versus a 15-year-old dog, the conversation may be different.
What treatment options are available for dogs with cancer, and what are some possible side effects?
So I know this might sound crazy to some of you, but there is oncology for dogs, 100%. Just like we have oncologists for humans, there is oncology veterinarians for dogs. They are boarded specialists. There is chemo, just like there is in humans. I would say the biggest difference is in dogs and cats, we're not going for a cure, we're going for remission and quality of life. So we are not giving the same doses of chemo that humans are getting. We are not trying to cure our animals because they just don't live long enough. We're trying to get quality of life. And that being said, we don't see as many side effects in our pets as we do in humans. If you've had a family member that has passed away from cancer and has gone through chemo, they look like they've been through hell. Like, it's horrible. We are not doing that to the pets. That's not the goal. We also have radiation therapy, which can have some localized side effects with some skin irritation. But once again, radiation therapy, we're going for palliative care, pain control, and quality of life, not quantity of life. So I think that's a big distinction. So those are going to be like 2 main treatments. And then surgery. There are a lot of cases we can go in and cut it out. And that might be completely curative in some cases. So surgery is also an option. We just have to know what we're dealing with first, and then we can kind of go from there. And I would say one last thing that's become available to us is the Onco9. That is an actual blood test. It's a screening tool. So we get a sample of blood from your dog and we send it off to the lab. And within 14 days, we'll get an answer that says cancer yes, cancer no. They've learned how to check for cancer markers in the blood. Now, a percentage of them will be able to be identified by that test. Most of them won't. It mainly is a screening tool that we use, much like in humans. So it tells us cancer yes, cancer no, and if it's no, how relieving is that? So if you're interested in learning more about that in like that test that we offer here, you can make an appointment, give us a call here at Four Paws, and we can chat a little more about it. All right, thanks guys. I hope this answers some of your questions about dog cancer.